think we'll get started. We've got a little bit of housekeeping to do, and that way, as folk will continue to let folks in as they arrive, and that way we can be respectful of everyone's time. Good morning. My name is Brenda Schaefer-Pellenin. I am a cisgender white female with a middle-aged female with a pixie cut and a black and gray outfit today. My pronouns are she and her. And I am joined today by my colleague, Ashley Craiglow from the Arrowhead Area Agency on Aging, as well as Sean Herhusky, Chair of the Arrowhead Regional Consortium for Healthcare Staffing. We'd like to welcome you and thank you for joining us for today's session on addressing the healthcare staffing crisis, labor market insights, and solutions for long-term care in Northeast Minnesota. Before we start, a few housekeeping items. We are excited to announce that today's webinar will be accessible to a wider audience. We have arranged for American Sign Language interpreters who will be present throughout the session, rotating every 15 to 20 minutes, ensuring that everyone can follow the content effectively. To access that ASL interpretation, simply select the interpretation button at the bottom of your screen. Additionally, we're recording the entire webinar with ASL interpretation. These recordings will be available on our YouTube channel for later viewing. So whether you will attend the live session or you catch up later, you'll have the opportunity to engage with the material in a way that suits your needs. I encourage you to subscribe to our channel so you can keep up with the latest additions to our video library. We are always looking for suggestions for future webinar topics. So if you have suggestions for topics or speakers, please feel free to send those to me. And Ashley, we will share our email addresses in the chat. Please keep your microphone set to mute. Just a note, if you do experience any issues with bandwidth or audio quality, it often helps to disable your camera. If you'd like, you can enter your name and your organization or community that you're from in the chat, what you hope to get out of today's session and how you found out about it. If you have questions during today's session, please feel free to enter those questions in the chat and we will coordinate follow-up questions once the presentation and panel are completed. If you have, at the close of today's session, you'll see a quick evaluation appear on your screen on your browser. So please take a moment and complete that survey. It helps us greatly in planning future sessions. And one last reminder, visit our Facebook page for more information about upcoming sessions, such as funding opportunities for those serving older adults in Northeastern Minnesota we've got coming up in June, and volunteer opportunities in the Arrowhead coming up in July. You can also check out that on our website at arrowheadaging.org. So a little bit about our organization. The Arrowhead Area Agency on Aging and the Arrowhead Regional Development Commission are designated by the Minnesota Board on Aging as the Area Agency on Aging for Planning and Service under the authority of the Title III of the Older Americans Act. The Arrowhead Area Agency on Aging is committed to helping older adults maintain their highest level of independence. Area agencies on aging are regional organizations that provide services, supports, and information about just about everything that older adults and their families could need. In Minnesota here, we have 7 area agencies on aging across the state that are local connections to older Minnesotans and the community supports that they might need as they age. The Arrowhead Area Agency on Aging's PSA is designated by the Minnesota Board on Aging to include Aiken, Carlton, Cook, Itasca, Koochiching, Lake, and St. Louis counties. I'll take a moment real quick to read our Arrowhead Area Agency on Aging land acknowledgement. As we support our mission to help older adults maintain their highest level of independence, we do this while being respectful of the space that we are being welcomed into by Indigenous people. We strive to deepen our understanding of the multiple ways in which people see and understand land and acknowledge the Indigenous people who have relationships with this land. We also acknowledge the decades of historical trauma, loss, and grief experienced by Indigenous people. It is our promise not to only recognize these truths, but also to take action to show support of our Indigenous elders, neighbors, and friends, and understand our place within the past, present, and future of this land. We know that this is just one step in recognizing and honoring the sovereignty of tribal nations. Today's presenter, Anthony Schaffhauser, is the Department of Employment and Economic Development's Regional Analyst for Northwestern Minnesota. Anthony conducts research, writes publications, and provides presentations about Minnesota's economy. job markets, industry trends, and career opportunities. He has a master's degree in public policy analysis from the University of Rochester in Rochester, New York. And Anthony previously served as the Director of Healthcare Workforce Development for HealthForce Minnesota. He brings healthcare expertise to his research and his analysis role. So following Anthony's presentation, we will have a panel discussion with representatives from skilled nursing, assisted living, and home and community-based services, both paid and volunteer models. So now I will turn things over to Anthony.
Well, everyone, thanks so much, Brenda. So let's just go on. Let's dive in here and go on to the next slide. I've got a lot to go through here, and so I'm going to be moving quick, but stop me if something's not clear or if you disagree. So this is Northeast Minnesota's unemployment rate. So the unemployment rate's essentially the percentage that are actively seeking work. And a couple things I want you to note on this graph is that the unemployment rate, first off, if we take the long view, it's lower than it's ever been in the past. I mean, the statistics only go back to 1990 at sub-state level, but this is unprecedented. It's representing an unprecedented tight labor market. So for those of us in healthcare, I would just say you're not alone. This is a broader thing, and I'm going to spend a couple slides on this because I think it's important to understand the bigger picture. Another thing I'll point out here is that the monthly all-time low for Minnesota and nearly everywhere else besides Northeast was in the spring of 2022 during the pandemic recovery. Northeast Minnesota just hit the all-time monthly low in October of 2024. So what we're seeing is kind of the same sort of acute tightness in the labor market, but it's continuing on much further past the pandemic than other parts of Minnesota. All right, next slide. So what I want to point out now, I've added employment and the labor force to the same thing we had before. And I pretty much just want to point out that there's that significant dip right there, in the labor force with the pandemic. But if you look at the longer term trend, you can see that the labor force had already stopped growing in Northeast Minnesota before that dip. All right, next slide. So I've mistitled this one for Northeast. In most places in Minnesota that I present about in the statewide, it's slower growth in the labor force. In Northeast Minnesota, it's actually a slight decline in the labor force. So how did we get here? We had that slight dip. The labor force, though, was already declining before that, and so I drew a couple trend lines on the labor force curve there, and you can see that if you take a trend line from 1990, it ends about 2002. So what happened in 2002? Well, 2002 is when the oldest boomers started turning. Actually, in 2001, the oldest boomers started turning 55. And that is the age when labor force participation starts to drop off. And so the Northeast Minnesota is much more reliant on the baby boomer workforce than other parts of the state, especially the Twin Cities. And so the trend change is pretty prominent here. And it actually led to a slight downtrend in the labor force at that time. And the boomers are still here, still in the workforce. And until they're all out, it's going to continue to impact the labor force. It also impacts the demand for healthcare. So it's kind of a double whammy. But so why did the labor force start declining? One explanation that I've heard too many times that I can count is that nobody wants to work anymore. Well, you can go on to the next slide. I don't know if any of you have heard that. Well, is it that nobody wants to work anymore? Well, if that's true, it's been true for 135 years. So I particularly like this. Well, these are newspaper clippings. Somebody went and researched all the times that nobody wants to work anymore has appeared in the media, print media. And I really like this one from 2014. It has not always been that way. Well, it's been that way since 1894 anyway. So maybe we could say it's always been that way. Anyway, next slide. So I looked into this for Minnesota, where we have, all kinds of data available that I can dig through. And I thought, well, let's look at labor force participation, the labor force participation rate by age, and let's look at the change in the labor force participation rate by age rather than just the total. And what I was getting at here was that overall labor force participation rate can go down even if every age group has labor force participation go up, because because of the aging of the population. And what I found was that in Minnesota, it's only the age 55 plus that had declining labor force participation from 2019 to 2023. So when people say people don't want to work anymore, they seem to be implying that young people don't want to work. But actually, it's the youngest age group that had the biggest increase by far in labor force participation. And also in some other border states, that was also the case. So it's just not true. So let's bust that myth, and we'll move on from there. Next slide. Okay, so where did all the workers go? That's the other question I get and had been getting a lot. And yeah, there are some what I'll call short-term COVID-related impacts. And one is the huge dislocations that happened with COVID. I mean, my own personal barometer of when we're fully out of COVID is when our grocery store has those spicy pickles I like back. They're still not here. And who knows if it's ever going to happen. And so there were huge dislocations, supply chains. People couldn't go back to the same job. Most of them, their whole carpool, childcare, all that was all messed up. And these huge dislocations were a lot bigger in healthcare than they were in other industries. So the other thing that happened is that there was decreased immigration with the pandemic, and this had resolved. We were back actually to greater immigration than what was before the pandemic. But ... Okay, there was also increased retirements. That's partially resolved. People retired early along with the COVID pandemic, but they didn't retire 20 years early or 10 years early or 5 years early. It was more like 2 or 3 years early. So now that we're 2 or 3 years past the pandemic, that's resolved. But the bigger issue that came about was that there was a decrease in the rates. I call it the rate of unretirement. People that stop working and then go back to work, that also decreased. And so that's not totally back to where it was. So that's why I say partially resolved there. Caregiving for children and elderly parents, it's improved, but it's still an issue. And finally, long COVID, there were an estimated, the Brookings Institute studied all the studies on this to try to estimate what the workforce impact was in terms of full-time equivalent, or FTE, from people either having to stop work or working fewer hours because of long COVID. And they said, it's about 1.8% of the labor force, the impact in lower FTE. If we were to translate that to Northeast Minnesota and assume it's the same as what they found for the US, that'd be about 2,850 workers, FTEs in Northeast Minnesota. And note that the labor force shrunk by less than that, by 2,143 from 2019 to 2024. So that could be a big part, or maybe all of the reduction that we experienced. But all those are resolving, or they're not going to resolve, and so it's in the past. On the right-hand side here, these demographic trends, these are long-term, and the aging population is what is with us now for a long time. It started happening over 20 years before, and it's still with us. All right, next slide. Okay, so that's it for the big picture. Now let's get into healthcare. So here's nursing and residential care employment for Greater Minnesota, and Twin Cities. Twin Cities is in the dark orange there. I don't know what happened. I didn't make the box big enough to get it on the legend there, but that's the dark orange is the Twin Cities there. And what you see is that Greater Minnesota, it started coming back pretty strongly like other places, but it never got back to pre-pandemic levels. This is the employment. And in Minnesota, it's back and it's grown, but that's obviously brought up by the Twin Cities, which is way higher than it was before the pandemic. And a lot of this has to do with immigration. Especially the long-term care industry is very reliant on immigrant workers, and most of those are in the Twin Cities. So Greater Minnesota didn't get as big a boost from that, and that's what's going on. Now let's look at Northeast Minnesota. Next slide. Okay, so as I said, Greater Minnesota is down. It's down about 1,462 jobs, or 2.5% from pre-pandemic. Northeast Minnesota is down 1,209 jobs, or 11.5% since before the pandemic. And I'm looking at average annual employment here, but the graph is showing quarterly, so that's why the numbers don't exactly match up, because I'm averaging a year. But so it's interesting to see here that Greater Minnesota would have been down only 253 jobs if Northeast had held steady or gotten back to pre-pandemic. So this issue is a lot more acute in Northeast Minnesota, and so you guys are really going to have to be better than everybody else to pull out of this. Next slide. And here's the same information for home health care, that industry. It did recently recover in Northeast Minnesota. It's up to 722 jobs, which is kind of on par to where it was before the pandemic. But I mean, I'm not that far out of touch. I know that we didn't have enough home health before the pandemic either. So it's not in any way resolved. The other thing that I would point out here is that all of this recovery happened in 2024. If you look at the last 4 dots on that black line there, that's all 2024. So all of the recovery just happened pretty much after first quarter of 2024. And this is important to note. It'll be important to see later when I try to analyze who's coming back into the labor force. All right, next slide. Okay, so we're talking a lot about recruiting. We have been for a long time, and that's certainly important. But I went through and dug into DEED's labor force projections, and we have projections by occupations, 10-year projections. We call them long-term projections, right? What you can see is that for Northeast Minnesota, home health and personal care aides, 10.7% growth projected over the 10-year period to 2032. Nursing assistants, only 1.9% growth projected for that occupation. So I mean, there is high projected growth for home health and personal care aides that serve the home health industry. This. Sorry, I'm getting a call. Okay, sorry. But there's lower projected growth for nursing assistants. I don't agree with this. I don't think that the projection is accurate. I think it's way too low. But the fact is that the 2 facts about it. One is our projections methodology just takes the trend in the past and projects it into the future. That's how it works. So since there hasn't been a lot of growth in nursing assistants ever since about 2014, that's what the projection is going to show. The other thing is it really doesn't matter, because there's 76 times more nursing assistant openings that need to be filled due to labor market exits and occupational transfers than there are from growth. And so, that's turnover. Those are people leaving the labor market entirely, or people changing occupations from, say, nursing assistant to being a nurse or working in retail or something else. So it's really much more the issue is turnover, and whether it's 1.9%, 10.7%. I projected 10.4% growth for nursing assistants for Minnesota, just for nursing homes. But even though that seems a lot different than under 2% growth, it really doesn't matter. We're gonna have the need even with no growth. All right, next slide. So what does this mean for recruiting workers in long-term care? Well, the short-term effects of the pandemic are passing, but the long-term trends will be with us, and it's going to keep the labor market tight, which means, like I said, you guys are going to have to be better. So any new creative or innovative approaches you develop, if they work, they're going to pay off for a long time. Because so don't think, well, we just wait it out, or let's not try something drastic, or let's not go crazy here. No, go crazy. Let's do something, because if it works, it's going to pay off for a long time. And where are the opportunities as I see them? Well, one is to stem turnover. And I don't mean don't let people advance in their careers. Absolutely. By providing advancement in your careers, you're going to help get more people into those professions. But are there ways that people can at least stay long enough to get to that next career? The other thing is I see as an opportunity is to getting some of the workforce back that left due to the COVID impacts. Caregiving, long COVID, burnout, especially in healthcare. And there's a lot of industry transformations going on in healthcare right now, where, basically because of the financial instability, which certainly doesn't seem to be letting up, that there are opportunities for people who are laid off from their job. The other opportunities here are youth, older workers, Black, Indigenous, people of color populations, people with disabilities, and all these other groups with higher unemployment. So that's getting those folks participating in the labor force, doing workforce development, is a big opportunity in my mind. All right, next slide. Okay, so let's look at the job vacancy survey relative to job seekers. And okay, big news flash: hiring demand is off the record highs, but it's still elevated. So here's Northeast Minnesota job vacancies and unemployed. And I've got a vacancies per job seeker ratio here, which is at 1.4% for 2024, meaning there's 1.4 job vacancies per job seeker. So what does that mean? Well, that means that even if every job seeker were an immediate fit for an open job, there would still be over 30% of the vacancies would still be unfilled. And of course, every job seeker is not an immediate fit for an open job. That's why unemployment is not zero. So that's the situation. And we used to talk about the number of job seekers per vacancy, but ever since about 2018, that's pretty nonsensical, because you end up with a fraction of a job seeker per vacancy. So I'm talking about vacancies per job seeker now, and that's just another reason, just another indicator of the tight labor market, and it's been here for a while. All right, next slide. So let's now zoom in from all the vacancies, job vacancies, into healthcare and social assistance, which is the industry sector and how we define it. And this is showing the job vacancies for healthcare and social assistance and for all industries, or the total of all employment here. And what you see is there's a similar pattern here with healthcare and social assistance, but the 2022 peak is a lot more pronounced. What you also see is that from that 2022 peak to the most recent data, which is 2024, there was a 55% drop in healthcare compared to a 31% drop in total. So the vacancies have come down quite a bit. And I guess that's good news. The jobs are getting filled, but you also see that the vacancies for healthcare and social assistance is, well, it's back to where it was in 2018. And as we all know, there was a lot of unmet demand in 2018. So that's about all for that. Let's go to the next one. I think it's going to be a much better comparison, though, rather than talking about total vacancies, to look at the vacancy rate. The vacancy rate is just the number of vacancies divided by the number of filled jobs. So you can think of it as a rate or a percent. And here what we see is that the healthcare and social assistance has consistently higher vacancy rates than total all industries. And then since the pandemic, for lack of a better term, it's more higher than all industries, as you can see from the graph there. So yeah, so if you're going to think about a tight labor market and you're going to think about which industry is most impacted, it's certainly going to be healthcare and social assistance. All right, next slide. So, and if we look at the number, the occupations with the most job vacancies, 3 of the top 5 are in healthcare. So keep in mind that the job vacancy rate for all occupations in 2024 was 6.2%, and all of these are significantly higher than that. I've also put the median wage offer. These are the wages, the median wages for the open positions in 2024. We don't have a vacancy rate in the chart here for personal care aides. If you guys want to join a letter to it's because the Bureau of Labor Statistics stopped the Occupational Employment Wage Statistics program for estimating employment for personal care aides and home health aides separately. And if you guys want to join me in a letter to their data group or whatever, we can do that. I'm not happy about it, but it is what it is. It's 14.1% for the combined personal care aides and home health aides. All right, next slide. Now, I talked before about, that because of financial stress that a lot of the healthcare industry is experiencing, some layoffs, some reorganizations, and so forth and so on. And I'm just going to call this churn. This is greater opportunity, right, for some folks in Northeast Minnesota. I've got the Minnesota's unemployment insurance initial claims. Okay, these are from layoffs. It's higher than pre-pandemic and trending up. And in healthcare, it's more so than total for all initial claims. What you see is that the slope of that, it moves around a lot, but if I put some bars on it, you can see the slope is higher on those green dotted lines for healthcare initial claims. And this is Minnesota. It's not Northeast Minnesota, but when you look at that labor force trend, you guys are going to need more people in your labor force. So I would encourage some attempts to recruit from outside Northeast Minnesota for these laid off workers, because you can see it's higher highs and higher lows than before the pandemic. So there's more layoffs. All right, next slide. So I gave a presentation at the Leading Age Minnesota Institute this February, I think it was. And I used the poll everywhere thing here and did ask a few questions of the audience. And one was true or false, at least half of our hires were employed at another facility. Okay, well, that's pretty overwhelmingly true for the people that were there. All right, next slide. And so I looked at the data too, and you know what? They're right. You look at this, it looks like it's pretty much half and half. The total in the dark blue line is kind of adding together the lighter blue lines, which are hires from non-employment and hires from job to job. So it may be higher. It may be even higher than this based on their responses. But the point is that employers are competing for workers. Workers have an opportunity to take a better job that works better for them. And this is important on that whole turnover issue. I'm more concerned about the turnover that I talked about, which is people leaving the labor force or people leaving an occupation, especially if they're getting out of healthcare. If they go from one employer to another, so be it. Let's all just be the best employers we can and let the chips fall where they are, as long as we can meet the need. So I guess strategize accordingly. All right, next slide. One of the issues, okay, with turnover is that the wages in nursing care facilities, which we call nursing homes, home health services, and I'm not even going to say that title, we'll just say assisted living, are lower. I've got them highlighted here than a lot of the other industries. So, you look at, I've got the median wage here, but I've also got a range, which is due to sampling error there. But it's lower wages. So I mean, this is an issue that it's just got to be recognized. If you can pay more, do it. But if we could do it, we probably already would. But you're going to have to come up with something else, right, to keep workers in these industries if you can't pay more. All right, next slide. And this is the same information for nursing assistants. Again, median wages, again, lower for nursing homes, assisted living, and home health than it is for many of the other industries. So same story as with nurses. All right, next slide. So here's this groups with higher unemployment. This is showing for Northeast Minnesota. Again, younger workers, older workers actually have, at least in the 65 to 74 age group, have a lower unemployment rate, but they're still a minority in the workplace. People over 65. So I think there might be an opportunity there. You've got your BIPOC workers with higher unemployment, workers with disability, which includes veterans with a disability. Those are the groups with higher unemployment rates. Those are the groups that are, if you want to call it, the hidden labor source or whatever. That's an opportunity in my mind. All right, next slide. And we'll look at all of greater Minnesota here. Well, what do you know? It's the same groups that are available. So you can pretty much put I can go down to the county level with this sort of stuff. You put a pin anywhere on the map. These are the groups that will work in terms of recruiting from those groups with higher unemployment. But one interesting thing about this, if you compare greater Minnesota, these rates are lower than they are in Northeast Minnesota. And I think a lot of that is people that are tied to a certain industry, not changing industry, people that are tied to a certain place and not able to move across the region to where the jobs are, for example, not able or not willing. It seems to be transportation and being fixed, I think is the cause of the higher rate. So I guess say strategize accordingly, I guess. All right, next slide. Okay, here we're showing, this is a lot. Don't ever do this. Don't ever put this many numbers on a PowerPoint slide, but I just don't know how else to get this information across. Let's just take it piece by piece here. This is Northeast Minnesota nursing and residential care industry and the employment by age and sex, okay? And if you just look at the totals and the youth, the youngest and the oldest workers for males and females here, you'll see what I'm talking about. It's seniors and youth that are filling the need. So if you want to get on that wave, if you want to ride that wave, that's where, I mean, all the cool kids and all the wise people, old and wise people are doing it, so, you can ride that wave. It's interesting too, males declined a couple % less than females. Statewide, males grew since the pandemic. We need more woke guys in Northeast Minnesota, I guess, but so can work on that maybe. All right, next slide. Now I did the same analysis here for home health care, and I'm sorry to say it's too soon to tell. Remember when I showed the employment, it only started to really come back in 2024. Well, this only goes through third quarter 2024 because we produce these data, we send it to the Census Bureau, they add the demographic information to it, and then they wait for all the other states to get it done, and then they publish it. And so it's just going to be a little while. So, hey, check with me in about a year, and I'll tell you where the growth was. You're seeing it a little bit, I mean, youngest growth there, 100% for females, 14 to 18, yeah, but it's only 4. I don't know, you see it a little bit in the 65 to 99 age group for males, but again, it's only 7. So maybe we need a little more data before we say it's there. But if you want to anticipate the trend and go for that, I think that's reasonable. All right, next slide. So the other way we could look at the same data set is to look at it by race and ethnicity. And so if you look at nursing and residential care, you can see that white alone was responsible for almost all the decline. The total decline was 1,434, and 1,505 was the drop for white alone. So basically, diverse workers bolstered the workforce. It still declined, but it would have declined 8.6% rather than 7.6% if it wasn't for diverse workers. So in nursing and residential care, it's Asian Pacific Islander, 2 or more races, and Hispanic that all grew, and they grew faster, I guess I misspelled faster there, than for all industries. And Asian and Pacific Islanders declined in all industries. So that's something where nursing and residential care was bucking the trend. All right, next slide. I just threw Minnesota in here. It's the same deal, right? Every group besides white alone grew. Same with all industries. I just wanted to show that there is a lot more diversity, and the growth rates are higher in Minnesota as a whole. And so, if you're gonna look at what the in the SWOT analysis, what the challenges are, one thing is that the population in Northeast Minnesota just isn't as diverse, and healthcare relies on that diverse populations for the workforce. All right, next slide. And we can look at it from greater Minnesota as well. Interesting, the BIPOC group, every BIPOC group grew faster than in Minnesota. So in other words, if you pulled the Twin Cities out, might be surprising. It was surprising to me the first time I saw it, that growth was actually faster for BIPOC populations in greater Minnesota, at least except for the Hispanic and Latino populations was faster in Northeast Minnesota. But in all of greater Minnesota, Northeast Minnesota, besides Hispanic and Latinos, had slower growth than greater Minnesota as a whole. So that's something that maybe could be addressed long-term, but it just needs to be recognized as a challenge to overcome for sure. All right, next slide. Okay, peak nursing home demand. So here, my buddy Kelly Ash did an article. He used my method to project nursing home demand, which is based on the current population survey of the percentage by age that are in nursing homes. And after age 85, it increases by 4-fold, which shouldn't be a surprise to anybody, but that's basically what happens as the population ages. There's more nursing home demand. So peak for the state is in 2047, and Kelly produced this nifty map here that shows when the range of years where the peak is going to be. A lot of Western Minnesota is already at the peak. Northeast Minnesota will be there before the Twin Cities, but there's still a little time to gear up where there isn't in Western Minnesota. Anyway, we're looking at, depending on where you are, 2035. So once we hit peak, then I guess maybe we can start sleeping at night again. All right, next slide. So the summary and conclusions, well, both short-term COVID-related and long-term demographic trends are impacting Northeast Minnesota's labor market. Big surprise there. The COVID-19 tightened the labor market, but demographics have been doing it already. And long-term, I love the quote, demographics is destiny. And so labor force growth is slowing due to the aging population. That's going to continue until all the boomers are out of the labor force. Successful strategies or innovation you develop to fill these jobs are going to have benefits long into the future. So don't think that you can't take on a longer term initiative. at this, because it's gonna pay off. Don't think that you can't try something crazy, because what do you got to lose? All right. There's a few things. Increase worker diversity, bring caregivers and older workers back into the workforce, target youth, age 65 plus, people with disabilities, and that's where the unemployment rate's higher. So that hopefully, I hope that helps. I look forward to hearing from the panel.
All right. Thank you, Anthony. And I'm going to hand things over to our moderator for the panel. And that is Sean Herhusky, who is the chair of the Arrowhead Regional Consortium for Healthcare Staffing. Unfortunately, one of our panelists had a family emergency, wasn't able to join us today. But we have some wonderful folks representing skilled nursing, assisted living, and home and community-based services. And I'll turn it over to you, Sean.
Sure. Thank you very much. And I just want to take a moment to thank Jennifer, Alicia, and Kelly for joining us today and being part of this excellent panel. I think what I'll do is I'll call on each one of you individually with the questions as we go, and then you can jump in. I'm just going to take it in the order as presented, no favoritism here, and we can just go ahead and begin. And the first question, I'd like to start with Jennifer and just go with sort of the large scale question of, with your expertise, with the work that you're doing, what is the biggest challenge that you're seeing in healthcare today?
It's just finding the appropriate workers for the appropriate job right now. We've been, over the past 5 years, we've been in a desire to get quantity versus quality. So now we're refocusing and regenerating to that more of the quality, especially for our aging. And we've been hit just as hard as everybody else. But I think that's one of our big challenges up here in northern Minnesota. I'm finding in Silver Bay particularly, one of our, and this might come up a little bit later, but one of our barriers is the housing market. We're finding a lot of our people want to come work here, but they don't want to be driving an hour and a half to 2 hours to get to work. And so our housing market's really tough. But facing healthcare, a lot of it has to do with just finding the quality versus the quantity of people.
Absolutely, absolutely. And Alicia, I'd like to get your thoughts on this as well.
Turn on my video and not my sound. I agree with what she's saying. I was here through the pandemic as well, and like she said, like with the quantity, you have to get workers, and you need someone to be there and be present and taking care of these people. And what we found is, sometimes if you get the quantity, it's not always quality, and so then you lose good team players. And so we really kind of refocused, honestly, with our assisted livings. What are we looking for? And we actually put together attributes, like what characteristics are we looking for? And we present that in our interview process. So yeah, just like she had said, really the quality of staff was, and it still is, like a key factor.
That's fantastic. That is a good takeaway. Kelly, let's get your thoughts on this as well.
Well, we're seeing the same thing here in our community-based healthcare program. What we're finding, though, is the pool of applicants to pull from in Silver Bay and our surrounding areas is just so small. And we don't pay enough to have folks move into the community, unfortunately. And so it's really trying to tap into the folks who are currently living here and getting the word out to those folks that, hey, we have job openings, and trying to market a little bit differently to reach the folks who are living here. So it's some of the same. And luckily we haven't had a lot of staff turnover, but when we do, we can have a position open for 3 to 4 months. And just hoping that we'll be able to connect with the right folks to fill those open positions.
Absolutely. So then the next question I'd like to tackle is, what do you see as the top factor contributing to the burnout in healthcare workers? And how are you addressing burnout and supporting staff well-being as you move forward? And again, we'll begin with Jennifer.
I'm so glad I'm the guinea pig. No, I'm just kidding. You know, this is a hard thing. We talk at the Veterans Home, you guys. We've been talking a lot about. We're in our annual in-service right now. We do a lot of education surrounding this, and we're in a big work-life balance situation right here because there is burnout, and I can compare burnout from COVID and I can compare burnout from now. Where we found our burnout is that it was our quantity of staff and the staff that we have that's been here for a long time getting frustrated and burnt out having to be with other staff. So I'm going to say travel staff in that word. We've actually transitioned completely out of travel staff now, but we promote a lot of well-being at our workplace. We try to do things. We have challenges going on at work that we do for well-being. We have mental health days that people are allowed to take. We take mental health seriously. We do walking challenges. We really try to make sure that people are getting their vacations and their time off. Because that's super important. You need to be away from work as well in order to rejuvenate and get yourself. So we have schedules of vacations and we have people that will cover people for vacations. This is hard. It's hard to support that. But being aware of it and making sure people know what's available out there and making things fun at work too to promote that well-being is huge because then the people know that they're supported at work and they can take it home as well. So we have lots of challenges going on right now, but well-being is a huge part of our culture. Work-life balance is a huge part of our culture right now. So I hope everybody can do that.
No, those are some fantastic points. We'll go on to Alicia then.
I can give personal experience. So when I started, I was the only nurse, and I had an LPN. So I was the only RN, I should say, not the only nurse. I was the only RN, and I had an LPN. We had assisted living. We don't have nursing on site 24/7. So I was on call. And then I will say from an administrative perspective, with the schedule being on call 24/7, burnout happened quick. And for me, at that time, there was really nothing. There was no other option. I was it. I had a baby. Baby came to work with me. Since then, like I said, and I thank our owner for this, for giving us the support, but we've been able to kind of restructure and get the added support with nursing and realizing one person can't cover all of our facilities. So that's one of the things we really started to focus on, and probably because we kind of went through it ourselves. We do staff socials. We actually took kind of like a survey with our staff, and we changed our staffing schedules to 12-hour shifts, which some people might think, but that was kind of their input because then they had more time off. So yeah, those are kind of some of the things that we've been doing, rotating like our on-call so that people do get time off. So when they do leave work, they get to go home and spend time with their family. And then as well as just training, what are kind of some of the things we're looking for? What are the signs of burnout? And then one of the other things I wanted to mention, sorry, I have my little notes here, having a help pool or like a casual pool, because in this presentation, he had talked about, excuse me, I lost my train of thought. I was going somewhere with the casual. I'm so sorry. Just having like that extra support, sorry, for when we do have call-ins, when we do have the staff turnover, even training, we can hire someone and then you got 2 weeks worth of training with them. And so like having that casual staff to help support in those times.
No, those are great points. Thank you so much for making them. And then Kelly, if we can hear from you as well.
Sure. We also really encourage that balance of home and work. It's so important because it's in this world it can get really hard. The work is hard, and we really want to recognize that the work is hard and really provide opportunities for our staff to take care of their selves, their personal selves as well. We do offer flexible schedules for folks, and so that has really helped in that realm. If they can't make it to a client's home and know that a couple days ahead of time, we can switch that appointment around, or we can find another staff person to fill in. We really encourage open communication amongst our staff, so we can always have a good understanding of who really needs some time away and how to help fill that gap, and to making sure while the clients are still being provided the services and supports that they need. We also do lots of fun team activities, have potlucks, have a chance just to everybody get together, work through some problems and some questions that they may be having, do that as a team. And so there's that team feeling of support. So they know that they're not all in it by themselves. They're in it together as a team, and they have each other's backs, and working through those problems and helping kind of just navigate some of the things that come up. We also have an employee assistance program, and when folks are really needing some extra support that we can't provide, we really encourage folks to to contact our employee assistance program. We do trainings on how to contact them and what to expect when you contact them. So just to, again, break down that barrier, because for everyone, that first time trying something new is always can be a little scary. So we try to break that barrier down and make it a little bit more easier for folks to participate in that program as well. We also just do ongoing training opportunities for our staff, and that seems to help too, just continuing to provide knowledge and information to help them feel comfortable with different situations or different behaviors or different needs that our clients may have. That helps. We've noticed that really has helped decrease burnout as well. Folks feeling much more prepared and ready to navigate the challenges that they may find in their work. That's pretty much it.
Oh, that's excellent. Thank you so much for sharing. And I think we're coming to the end of our time, so I'll throw one more question out there. I won't make Jennifer go first this time. I'll throw this one out to Alicia. We'll go Alicia, Kelly, and Jennifer then. How are you integrating technology to support your workforce while maintaining quality of care?
Technology for us has been huge, although we started with paper charting paper. So technology wasn't necessarily welcomed with open arms, but it has been a great benefit for us. One of the struggles that we had during COVID, obviously, like just with staffing activities, and is a huge part of, I'm sure even like home care and everything, you know, in skilled nursing, it's a huge part of the care that we provide. So I'm so sorry. I'm so sorry. I have ADHD and I get distracted. Can you repeat the question? I totally lost my train of thought.
Oh, that's no problem. We're just checking to see how if technology has been any kind of help in supporting your workforce during and maintaining that quality of care that you're trying to reach.
Thank you. So yes, with the activities, that's where I was going. We implemented, it's called Linked Senior, and it was a tablet. And like I said, when we first went to our residents with this tablet, they kind of were like, nope, we're not doing that. But it has been really great. We actually can communicate with like other facilities, and they'll play like Wheel of Fortune against other houses, music opportunities, trivia. So it's something that we've been able to teach them so they could set it up individually, but we also now have activities directors where they can proctor that and kind of be the host of like the programs and stuff that they do. But that was a huge one for us that benefited. I won't speak more. I'll let the other ladies give their input too.
Oh, thank you so much. And then Kelly, we'll go to you next.
I'm going to kind of go down a different rabbit hole with this. We use a software platform where all of our home health aides can log in at the beginning of their shift, do their noting on the same platform on their phone, and then log out. So it's really slick. And so it's like they don't have to run in and try to like do all their stuff in the office. They can do it all remotely. And it just has taken, it cuts down on the time, it cuts down on the stress. Everything is right there at their fingertips, and they can just get everything done and scamper on to the next client. We've noticed that that's really helped kind of make life a little bit easier for folks as well. And they can certainly, in trainings, we do remote trainings, and they can watch on their phones or come in and use technology here as well. So those are just a couple of examples.
Yeah, those are fantastic examples. Thank you. And then we'll go to Jennifer.
Yeah, thank you. So I'll do it in two facets here. For our residents, you know, a lot of our people are those baby boomers and even a generation before them. So it's been really hard to get them to understand technology and certain things, right? We do a lot of iPads. We do FaceTime. I mean, it was wonderful to have them on FaceTime to be able to actually see their loved ones. We saw a lot of behaviors decrease when we introduced those. We also have a music program too. So we have a music therapist here, and she uses different kinds of headphones, whether it's the subcochlear or inner earlobes. So we do use a lot of technology with our residents. I know we're really trying to work on grants for some robotic actions, and I just don't know how people will react to that yet, but we want to start integrating some of that technology for our residents. As far as staff, you know, we're finding communicating is a huge thing with our staff and using technology. So we have a mass messaging system. So when we're short or we need somebody to come in or we have dire needs for things, it goes out via text, and we get so much better response because people can be like, yep, I can go in for a couple hours, whatever it is. And that helps with some different stylistic of scheduling too, because they can maybe pick up 4 hours here, but then another person will pick up 4 hours here. So technology has been helpful that way. Because it'll send out emails, it'll send out text messages. And then again, with some of our technology in our building, we just got new vitals machines that actually puts the vitals into the person's chart. So it's just that time saving factor like Kelly was talking about too. But we've been fortunate to have grants and stuff that we've been able to pay for these to do it too, because it's not cheap technology either. So it's huge. We have it in both facets for our residents and for staff and for convenience. So we'll continue to use it.
Thank you so much. No, that sounds absolutely amazing. And with that, I know we're coming to the end of our time, so I'm going to hand it back to Brenda.
Thank you very much, Sean. And just if anyone has got a question for either the panel or for Sean or for Anthony, if you want to just take yourself off mute and ask that question, or if you feel more comfortable, you can put those in the chat. If we do end up with more questions, we'll do some follow-up on those as well. Any questions?
Brenda, hi, it's Shauna.
Hey,
Just-
Shauna.
Sorry, I jumped in a little late, so I don't, just wondering if you're gonna hand out the slideshow. I thought that was very helpful.
Yep, we'll get copies of that information out to folks.
All right, thank you.
Mhm. All right, well, I will, when you can feel free to jump in, but I'm going to go ahead as long as we don't have anybody jumping in right now. Just a reminder for those of you, our upcoming webinars, if you're interested, we have ones coming up. If you or you know somebody who works in an organization that's looking for opportunities to serve older adults, we've got a webinar coming up on regarding funding opportunities for those who are serving older adults or would like to serve older adults in the Northeast region. That's coming up on Wednesday, June 18th. We also have one coming up on July 16th on volunteer opportunities across the Arrowhead. And lastly, we've got one coming up in August. Oh, it's crazy. We're already talking about the end of summer on accessing food resources in the Arrowhead region. So some really good information, whether you are a community member or an older adult or a professional working with older adults, some really good information. Again, if you have suggestions or questions about other topics that you'd like to see us do webinars on in the future, please feel free to email Ashley. She did put her email in the chat. You can also reach out to us in a variety of ways. You can jump over to our arrowheadaging.org website. You can email us directly. You can go to our Facebook page. We also have a LinkedIn page, and we also have a YouTube channel that you can check out. So without any further ado, I will bid you all a good day, and thank you so much to our panelists and to Anthony and to Sean for joining us today and being part of putting this on. And thank you again, and we'll see you on the next webinar. Thanks so much. Bye-bye.